Asthma. Asthma is a heterogeneous disease usually characterized by chronic airway inflammation. It is defined by the history of respiratory symptoms such as wheeze, shortness of breath, chest tightness and cough that vary over time and intensity, together with variable expiratory limitation. Worldwide, 339.4 million people are affected by asthma across all ages. Asthma contributes to 23.7 million disability-adjusted life years. Globally, about 420,000 people in the world died from asthma in the year 2016. Asthma is characterized by wheezing, coughing, shortness of breath, chest tightness or pain. Other non-specific symptoms in infants or young children may be a history of recurrent bronchitis, bronchiolitis, or pneumonia, a persistent cough with colds, and recurrent croup or chest rattling. The pathophysiology of asthma is complex and involves airway inflammation, intermittent airflow obstruction, and bronchial hyperresponsiveness. There are many factors that can contribute to asthma or airway hyperreactivity. Based on the severity, asthma can be classified as intermittent, mild persistent, moderate persistent, and severe persistent asthma. Intermittent asthma is characterized by symptoms of cough, wheezing, chest tightness, or difficulty breathing less than twice a week. Flare-ups are brief, but intensity may vary. Nighttime symptoms may occur less than twice a month. There may be no symptoms between flare-ups. In lung function test, the forced expiratory volume, FEV1, is 80% or more above normal values, and peak flow has less than 20% variability AM to AM or AM to PM, day to day. Mild persistent asthma is characterized by symptoms of cough, wheezing, chest tightness, or difficulty breathing 3 to 6 times a week. Flare-ups may affect the activity level. Nighttime symptoms may occur 3 to 4 times a month. Lung function test FEV1 is 80% or more above normal values and the peak flow has less than 20 to 30% variability. Moderate persistent asthma is characterized by symptoms of cough, wheezing, chest tightness, or difficulty breathing daily. The flare-ups may affect activity level. The nighttime symptoms may occur 5 or more times a month. Lung function test FEV1 is above 60% but below 80% of normal values, and peak flow has more than 30% variability. Severe persistent asthma is characterized by symptoms of cough, wheezing, chest tightness, or difficulty breathing that are continual. Frequent nighttime symptoms may occur. Lung function test FEV1 is 60% or less of normal values and peak flow has more than 30% variability. Asthma may be diagnosed using blood tests including blood eosinophilia and total serum immunoglobulin E. Asthma can be diagnosed by abnormal arterial blood gas measurement, high peristaltin levels, abnormal pulse oximetry measurements, chest radiography, and pulmonary function tests. Chest CT scan may show air trapping, measurable bronchial wall thickening, atelectasis, central lobular nodules due to mucus plugging, and acinar nodules due to low-grade inflammatory changes. ECG may demonstrate right heart strain. Other tests include MRI, nuclear imaging, allergy skin test, bronchoprovocation, peak flow monitoring, and impulse oscillatory. Management modalities of asthma includes pharmacotherapy including long-term control drugs and rescue drugs, allergen immunotherapy that involves injecting allergens under the skin, monoclonal antibody therapy, bronchial thermoplasty, and allergen avoidance. The long-term control medications are taken daily to achieve and maintain control of persistent asthma through inflammation control. It includes inhaled corticosteroids, leukotriene modifiers, and long-acting beta agonists. Other long-term control medications include mast cell stabilizers, omalizumab, and theophylline. Rescue medications provide immediate relief of bronchoconstriction and asthma symptoms or help relieve exacerbations. It includes ipratropium, short-acting beta agonists, and systemic corticosteroids. The strategies for prevention of asthma attacks and its exacerbation include information, self-monitoring, regular medical review and written action plan.